Hello, my name is Devin Dockstader, and I am the Athletics Liaison from Counseling and Psychological Services. Today, I'm going to be talking about some of the common psychological reactions that student athletes have following a sports injury. Probably the most common psychological reaction following a sports injury is anxiety. Some symptoms that you can potentially expect to have with anxiety is generally a lot of worry, persistent worry, and particularly worry that you do not feel like you have any control over. Sometimes maybe you just your mind going blank often. So we can also see how some of these symptoms of depression and anxiety don't just impact someone's experience navigating a sports injury, but also someone's experience trying to navigate keeping up with academics as well. The last thing that I will leave you with is you are not alone in these experiences, and all the feelings that you may be navigating following a sports injury are valid and worthy of care.
So when you look at the data that is presented by the NCAA and the NATA, it shows that 90% of all athletes in the course of their collegiate career and their eligibility will suffer at least one injury in their time. But they can take anywhere from days to weeks for these injuries to heal. And in that time, these athletes are not participating, so they are removed from their team and removed from competition, which many see as their identity and who they are. So you see a lot of mental health issues that arise from that. When you are abruptly removed from your sport, something that you identify as who you are, it's very easy to become depressed, and start doubting or questioning why something happened to you that has never happened before. Lack of confidence or loss of confidence is also very common when returning from injury. You see a lot of athletes that are hesitant to return to the same play or the same movement that caused an injury in the first place. There is that the hesitation, the lack of confidence to produce that movement, that force, that function again for fear that the injury can't happen. If we look at more of the invisible injuries, whether that be a hamstring strain, a concussion, an ankle sprain, and you look at healing rates and how everybody heals differently. One person may return in a week, in 2 weeks, while someone it may take a full season for that injury to resolve. The healing times are similar, but it is different for everybody. And when there is not a visible deformity, dysfunction, anything that we can physically see on the outside, sometimes that makes it harder for people to accept that their body is not functioning and performing as it should. As an athletic trainer and the sports medicine staff, we see all the days. We see the good days. We see the bad days. So it's important for us to understand, who the athlete is. When can we push them? When do we need to pull back? When do we just need to take a day to help them get through the day? Help them get through that rehab session. And then other days where we can push and say, hey, today's a day where we're getting better. Understanding who that athlete is, not only as an athlete, but as a person. Who are they outside of their sport, outside of, the team environment, really helps with that connection and helping, heal them both physically and mentally.
My name is Grace Hennigan, and I am on the women's swimming and diving team. I actually had a pretty serious injury coming into SIU. Right before I was due to commit here, I actually hit my hand on the diving board, and I fractured diagonally across these 3 metacarpals, and so I couldn't do anything. I ended my senior season with a cast, and it took a pretty negative toll on me mentally. Growing up doing sports your whole life, every day, all the time, and then immediately not being able to do any of it, it really took a big turn on my life, and I could feel like I didn't have my normal routine, and I did not like that. Some of the things I did during my recovery was kind of visualized myself at my peak performance, at my healthiest level. I knew that I could get through that because I've been through other smaller injuries, and I've seen myself get through that. So visualizing that and setting small goals for myself during treatments, maybe doing 1 extra rep of recovery and therapy, or doing a little bit more every day just to get myself back into full gear. My advice to an athlete who is going through an injury, take the time now to fully let yourself heal. Listen to your body. I had a coach who used to tell me, do it nice or do it twice. And as silly as that saying is, be nice to your body when you're injured. Recovery is even more vital when you are injured, so let yourself get that rest you need to fully recover so you don't have to recover again during a season. And lean on your coaches, your teammates, and your peers to help get you through that.